Every day in Kentucky, people want to feel better. They want to maintain an active lifestyle, and oftentimes they need help. Dr. Kevin Denehy is here with us from Bluegrass Orthopaedics. And Kevin, thanks so much for being with us. Back when my parents grew up, they kind of lived with chronic pain. You went to Geritol and everything, but that's not the case anymore.
No, absolutely. And, I think a lot of times when people think about joint replacement, they thought about it in patients in their 70s and 80s. And 10 to 15 years ago, that's the majority of people that got, joint replacement done. But now, more active, younger patients in their 50s and 60s are developing arthritis and needing joint replacement at a younger age.
Absolutely. And Kevin, you should consult with your physician. There's a lot of different ways to treat that chronic joint pain. But if you decide that a replacement is the way to go, you've got a great product now at Bluegrass Orthopaedics that helps you better do what you do.
Absolutely. So we've got a product called Mako Smart Robotics. And the way it works is that when we did knee replacement, we used conventional instrumentation. And honestly, the parts and the way that the parts are made and manufactured has changed a lot in the last 10 to 15 years. But the way we put the parts in really hasn't until now. And the way it worked is we used to make these conventional knee replacement perpendicular cuts to the bone, and then would have to release some of the ligaments to balance the knee. Imagine there's some deformity to the knee that develops in arthritis. Right. Some of the ligaments can be tight on one side versus the other side, and we'd have to release those ligaments to balance the knee. And when you do that, two things happen. One is that when you release a ligament, inflammation and pain happens from doing that.
Sure.
And then it's not as precise, right? You release a ligament, feel how tight the knee is, and release a little bit more, and it's subjective based on the surgeon's feel. With this new Mako Smart Robotics, what we're able to do is map out the knee with a CT scan ahead of time, and then intraoperatively we map out the knee so we know exactly where the knee is in space. And then we can use that data to change how we make these cuts. And we're very precise, changing 1 millimeter, 2 millimeters, 1 degree, 2 degree. And what that means is that we don't have to do these big ligamentous releases anymore. And we're able to balance the knee based on data and numbers and not just feel.
So it doesn't replace what you do. It helps you and your training better do what you do. Is that fair?
Absolutely. I'm not pushing a button and going having a cup of coffee.
Right.
But it's just giving the surgeon more data and letting them act on that data to perform a better surgery for patients.
You can Google Bluegrass Orthopaedics to get all the information. Kevin, thanks for being with us.
Appreciate it.
All right, and we'll be back with more Everyday Kentucky right after this.